we're now going to move on to some Q&A, and just to remind the audience to put their questions in the Q&A so that we can make sure to ask them. Remember, don't don't try to put them in the chat, put them in the Q&A, and we'll pick them up over the next 15 minutes or so. And Julian and I are going to coordinate, I think, to ask some questions of you both. Maybe I can just kick off a little bit with a kind of general question. So both of you really have been at the center of innovation, both like in terms of the science, but also of models of working, particularly with academic centres, really hand in hand with industry and the NHS and public health. And I wonder what your opinion is more locally within the UK, how we should plan for the future to get the infrastructure right, to make our response easier for the next virus. And I'm asking that of both of you, so either of you jump in when you want to.
Do you want to go first, Tess, or shall I have a go?
No, please go ahead.
Yeah, okay. Yeah. Well, models of working. During times of the pandemic, it was really key that everybody pulled together, and Tess talked about silos. And there are silos between different types of organisation, and each type of organisation has their own particular culture. And so academic institutions are different between each other, and they're different from the public health agencies. And during the pandemic, it was clear that everybody wanted the same goal. And so what I saw actually was that there was no barrier. Everybody piled in and did what they needed to, and just worked at pace to get it done. I think the question you're asking, though, Emma, is, how do we make that stick rather than let it ebb away? And at the moment, for example, COG UK will end its funding at the end of March. And so there will no longer be a consortium for sequencing of pathogens across the country. And my sense is that that actually the importance of infectious diseases to the security and health of this country has been realised in full. And I think that we have narrowly escaped what's happened with other pandemic viruses. And I think that now it's clear that we have to invest, and we have to get those really solid foundations in, which I don't think we were, I don't think there was that level of awareness of what might come. So the first thing to say is public health agencies are absolutely key to having strength in our country to respond, because they are the first responders after all. If you have a fire, the fireman comes along. If you have an outbreak, the public health agencies come along. But in addition to that, we must make science really powerful, because we are the critical partners, critical friends that go along and they do the innovation with our public health agencies. So not only do we have to invest in our public health agencies and their capabilities, which I believe that they are the first responders, we have to invest in science. And for me, I have to say that initiatives such as Horizon Europe and such funding initiatives, there's been two big reports coming out actually in the last week, one from the new Department of Science, and the other from Support Nurse. And we clearly need to invest in our academic community. So that's quite a long way of saying that I think that to prepare, we can't just recapitulate what we did before, which was done in an emergency, but preparation means training people, investment in public health agencies and in our academic community. That was quite long, wasn't it? I'm sorry about that, but
it's a great, thanks, Sharon. I guess we have new tools, right? We've got new tools that we can use, and they have to be placed in the middle of what we do next time as well. And then there will be more tools then, hopefully, also. Tess, would you like to also add something to what Sharon said?
Sharon's covered it really well, so I'm quite happy she talked for a while. I agree, Emma, that there will be new tools, there will be new innovations, but you're not going to have those new tools or new innovations if we don't invest in them. I don't want to do what we did again. I suspect Sharon doesn't want to do what she did again. So it's around future proofing, so that the next generation or our children or our grandchildren don't have to have such a reactive response towards a pandemic. And I really do believe that investment now will safeguard us in the future. It's a bit like house insurance. You don't appreciate it until your house is burnt down. And I don't know necessarily that there's enough foresight that how much this investment will pay off in dividends going forward. And we do absolutely need to invest in the NHS as well, and our people who are tired and worn out, and make sure that they're in a better place next time around.
For sure, and afterwards. Julian, would you like to
Sure,
ask something?
Thank you, and thank you both, Sharon and Tess, for wonderful talks. I was wondering if you could just expand a little on whether you've been surprised by this virus, whether it's behaved in the way that you might have expected, and indeed, you know, how different it is in terms of other similar viruses.
Shall I go first, because I'll be quicker?
Okay. No, I can do short answers, honestly.
No, I don't mean it that way. I'm not a virologist, is all I mean. So yes, I was surprised, Julian. I had my money on that this was going to be an influenza virus, that this was a wet market in China. It was going to be a flu virus. The next pandemic would be a flu virus. I was wrong. I was also very concerned because respiratory pathogens do impact children quite significantly, and that's not to play down the very real impact this virus has had on children, but it hasn't had the mortality rates that you're seeing in older adults. However, having said all of that, the way that the virus has evolved over time hasn't necessarily surprised me, but I will hand over to Sharon to talk more on that.
Well, thank you. And if I struggle, Emma, you're my next port of call. I would say that well, the first thing to say is that when the virus emerged, it was a fit virus. It was already perfectly capable of spreading. So it had this kind of R0, where you look at how many people one infected person infects. It's like 2.8. So one person will infect 3 people. And it had a couple of other tricks up its sleeve. First of all, the virus started to shed before you develop symptoms in people who are going to develop symptoms, so about a day before. So you're mixing with everybody, you don't realize you're sick, you're spreading it. The other thing is, of course, that we learned, the lesson of asymptomatic infection. So people going about their business, they didn't know they were infected. So this was a fit virus, however you look at it. And in many ways, its behavior was completely predictable. I mean, it sort of played using the Darwin playbook, if you like, of natural selection. I think the really difficult point is when that was going to happen and really understanding what would happen. But presumably, as we developed our immunity through being infected naturally, the population would actually build up a level of immunity. So the virus would actually be selected for to transmit more readily than the previous version. So it could like outrun its competitors. And that's what happened. But actually understanding when that was going to happen, there was no playbook for that at all. And the difficulty is watching the variants to see whether there was one that would behave like that. The other thing I would say is that, well, there's probably 2 more. The other thing I would say is that when Alpha emerged, it was a bit of a shocker because it had lots of mutations all in one virus, and it was really quite unusual. And that kind of like supercharged evolution, I don't think people had really recognized that, and that was a bit of a shock. And that's likely to have probably the most plausible hypothesis is that it emerged after having been in somebody and who couldn't shake the virus off. I think that I think that the third thing that really there's been a lot of talk about really is whether the virus will evolve to become more or less pathogenic and cause more or less symptoms. And I think that Omicron we're in a good position because it's actually become less severe in its disease severity. And one imagines it might continue along that track, although we don't know for sure. But there's nothing that's evolutionarily kind of an advantage to the virus become a more severe disease because you're likely to go to bed, not likely to mix. So there were some things that were predictable. The timing wasn't known. But there were some things that really did surprise me quite a bit, particularly kind of the degree, and Omicron too was hugely divergent. And so, yeah, it was, and finally to say that at the beginning, we were only learning by watching and understanding what was happening. And the power of hindsight is incredibly powerful now, because I understood we understood what was happening, but at the time we were learning as we went along. And that's a really important lesson for me.
Fantastic, thank you, Sharon.
I was going to say that like Omicron, if you look at the way we responded to Alpha and the way we respond to Omicron also was quite a big shock, right? Because it had a huge number of mutations. And I personally remember being really alarmed by those mutations because we actually recognized many of them. And so it was a bit unlike Alpha, where we didn't understand what those mutations exactly meant at the time because we hadn't tested them in the laboratory. We hadn't linked them at first with sort of clinical data. But then Omicron again took us by surprise because actually it seemed to be milder than the Delta variant, which preceded it. And I guess perhaps that highlights the need for other, not just genomics, which is incredibly powerful and helpful, and we can't have vaccines if we don't know the sequence and etc. We can, but it's better to know the sequence. But perhaps there's also a role for some of the more basic virology and making sure that the academic institutions are ready, and that it's almost written into the contracts of people who work within them that they should turn other things off and respond. I guess you're going to agree with that, but I remember being taken by surprise by that quite significantly. Can I pick up one other thing though, and just see what you think? Because one of the, like you mentioned, one of the critical groups of people who are seem to be at the heart of perhaps developing virus infections which are very evolved. How do we, where do we take that? We think perhaps that Omicron and other variants have evolved in people who have long-term or chronic infection. What should we be doing now to investigate that further, and also to evaluate how that affects those people, many of whom have got quite weak immune systems? Either of you could comment on that.
I'll give a brief answer because I'm just looking at the clock. My sense is that study of COVID-19 in the immunocompromised, who are the people we're trying to protect, is relatively understudied in many ways. And I think that they are the people we're trying to protect, and they are the people where variants could emerge. Although it is also hypothesized that people who are immunocompetent could also lead to a variant that's actually highly changed. But what do we do next? Well, for me, at the moment, it looks as if Omicron is sort of backed itself into a kind of an evolutionary corner. It's very transmissible, it avoids the immune system a bit, but it doesn't cause very severe disease. And there's nothing else on the horizon at all in terms of, it's just like offshoots of Omicron, which is like the kind of latest thing called Kraken or XBB 1.5. And that's more transmissible, but that's as far as it's got. And for me, I wouldn't be so bold as to know what's coming next. I would say that there's a reasonable chance that something else will emerge after Omicron, which is like an Omicron-like event. There's something really quite different that comes along. But I don't know what it's going to be, because we haven't been good at predicting what's coming and what it's going to look like. So all we can do is revert to watching, and actually watching very careful, particularly, if we haven't got the same capacity of sequencing, really selecting the populations who we study. So genomic surveillance, and the role of the public health agencies, right back to the importance of doing that.
That's great. Maybe we can just fit in one question from the Q&A. So it sounds like in the question, a need for a pandemic preparedness organization. The question is, what stakeholders would need to be included, and how do we get long-term funding prioritized in the UK?
I'll take the first half at least, because I'm part of PSI, Pandemic Sciences Institute within Oxford, but to my mind, and also Oxford Vaccine Group, to my mind, it needs a collaboration, a global collaboration. We can't be so UK centric going forward. We need to have the type of interactions, collaborations that we saw during the pandemic, at the height of the pandemic, because without us running trials in Brazil, we would never have known the efficacy, et cetera, et cetera. Without the sequencing in South Africa and other places, again, we really need that kind of global collaboration. As to how to get long-term funding, if somebody could tell me how to do that, I'd gladly try it. That's slightly flippant. I would suggest that at the moment we invest, and we being high-income countries, invest a lot of money in security and safeguarding our borders against possible attacks. And perhaps for a small fraction of that budget, we might be able to safeguard our futures against the next pandemic.
Thanks very much, Tess. Was there anything you wanted to add to that, Sharon?
I don't think so, except that we have to obviously fund critical capabilities such as vaccines, diagnostic tests, genomics, virology, and so on. But we also mustn't be too blinkered, because actually funding the best science wherever it is, you never can predict what the next science breakthrough is going to be, and you often so it's important that there's a broad portfolio of excellent science, and that does blue sky science to try and work out what the next breakthroughs are going to be, and not just trying to best guess that it's going to be the 5 things you've worked out were important in the last pandemic. So breadth of funding and adequate funding to train the next generation of scientists.
Okay, well, with that, I think those are the last words, Sharon. Thank you very much. And thank you both very, very much for participating in this webinar. And I really would like to express my sincerest appreciation for that really interesting conversation, and for taking the time to share your expertise with us. I hope everyone enjoyed the session, and thank you to everyone for joining, and thank you. Have a nice evening.